Welcome to Pain 101. I'm Michael Kalinosky. I'm a family doctor here in Viroqua. This class will talk about pain, where it comes from, how pain medicines work, and alternatives to medicines or additions to medicines that can help with chronic pain. In any case, this presentation is general information and should not be taken as medical advice. What we'll talk about: what pain is, what causes it, some of the neurology behind pain and the response to that, how certain medicines work, how acute pain can become chronic, and we'll spend a lot of time on ways apart from medicines, that is pills, that can be helpful. Pain can be physical or emotional. There is the official definition of pain at the bottom of the slide, but the thing to remember is if it hurts, it's pain. Where can it come from? Well, it can certainly come from an injury like a broken bone or a sprain. A burn causes pain. A wound causes pain. There's another type of pain called neuropathic pain. Diabetic patients know quite a bit about it. Multiple sclerosis also comes with neuropathic pain, and there are other diseases that have it. The pain is in the nerve itself. The nerve doesn't function as it was originally intended, and the response is pain. Internal illnesses can cause pain. Appendicitis, kidney stones, and internal bleeding are just a few examples. Tissues that are getting low oxygen supply will also hurt. The classic example is the guy who grabs his chest when he's having a heart attack. The heart muscle is not getting enough oxygen to do its job, and pain is the way that the heart lets the body know that something is wrong. This is an example of an injury, sliver going into the skin. On the right, you'll see that there's some swelling and redness, and the tissue can be warm. The circular items on the right-hand slide are called cytokines, and they are messengers that the body sends to an injury to begin the preparation for healing it. Unfortunately, these cytokines can be rather uncomfortable. When the wound is healed, the body sends another type of cytokine which relieves the pain. Another example of pain from the body is arthritis. On the left, you'll see a healthy knee joint. The cartilage is nice and smooth, and when the knee pivots, there's no friction and no pain. When arthritis progresses, that cartilage is thin and it doesn't do as good a job of lubricating. That can lead to some friction and pain. When it gets very advanced, as in the slide on the right, the cartilage is gone and there's bone-on-bone contact, which can be very painful. At this point, the options are primarily surgery or a cortisone injection. Pain can come from any organ in the body, with one exception. The brain itself does not have nerves that feel pain. You may have seen movies, TV shows, or documentaries where a patient is talking to the brain surgeon. This happens in real life. See that pain has many sources, and these are just physical sources. Pain can be emotional too. Depression, anxiety, post-traumatic stress disorder. These can all cause pain that is every bit as severe and disabling as physical pain from an injury or an illness. Next, I'd like to spend a little time talking about the neurology behind pain. The detail is more than you might have been looking for, but it should help when we try to explain how acute pain goes to chronic pain and how certain pain medicines work. This is a picture of a single neuron or a single nerve. The forked, pointed parts at the top are where pain is actually sensed. Now, there are nerves that also sense vibration, heat, cold, and light touch. The nerve cell is the main body at the top. What looks like a cable with balloons is what's called the axon. It transmits the electrical nerve signal to the bottom of the nerve where you find connections that it makes with other nerves in a chain or with the spinal cord. Those connections are called synapses, and we'll talk more about them a slide or two down the road. This is a diagram of the nervous system as it goes to the skin. The thick line in the middle is the spinal cord, and you can see at several levels nerves branch off and go to specific places on the body. There are nerves that go to very specific regions of the skin and nerves that go to very specific organs or zones inside the body. When pain is sensed, for instance, in the left index finger, that pain signal will travel from the nerve ending in the finger through a designated path to the spinal cord and up to the brain. This is a more detailed diagram. In this case, the person has an injured thumb. It travels along the arm and to the neck at the 7th cervical vertebrae and goes up the spinal cord to a part of the brain called the thalamus. If you look below the hand, you can see a person holding his or her upper abdomen. He might have a bellyache. That goes to a different level in the spinal cord, but it also travels up to the thalamus. Here we're looking in more detail at the brain. The sensation comes from the finger to the spinal cord and travels up to the thalamus, but the thalamus communicates with other parts of the brain. For instance, the smaller red area at the top of the brain is where the pain is consciously sensed, but there are other parts of the brain that don't think and don't respond consciously, but they play a role in processing the pain as well. Once the brain has sensed the pain, in a moment, it decides whether it's truly a threat or just an annoyance and sends a response down the spinal cord along a slightly different track, but out through essentially the same nerve pathway to the source of the pain. This may be what makes a person rub their belly when they have pain there, or clench their fist when they have a burn on the finger or get a cut on the finger. So let's discuss a little bit about how pain medicines work. There are three major classes of pain medicines: non-steroidal anti-inflammatories like Aleve, ibuprofen, and a prescription like Voltaren or Ketodolac. Tylenol is a pain medicine in a class pretty much by itself. And then we have opioids, the medicines like morphine, oxycodone, and fentanyl. The three main classes of pain medications are nonsteroidal anti-inflammatories. Examples are aspirin, ibuprofen, Ketodolac, Aleve. They work mostly at the site of the pain. I won't go into the details on the mechanism, but they are all filtered out by your kidneys. And that's why we have to be very careful if a person has high blood pressure or chronic kidney disease. Sometimes they can't handle that class of medicine. Tylenol works at the level of the brain and spinal cord. It essentially turns down the volume of pain. The third class, which we'll get into a little bit later in detail, are opioids. These are meds like morphine, fentanyl, Dilaudid, and hydrocodone. They work at the brain and the spinal cord and several other places. The side effects that they have can be serious and sometimes even fatal. Did you know the body has its own pain medicines? If you've ever heard of endorphins, that's what we're talking about. There are a couple of others called dynorphins and enkephalins, but we'll focus mostly on endorphins. Maybe you know a runner, maybe you've been a runner yourself and you've experienced a runner's high. That's endorphins kicking in. Maybe you've been to the gym and you worked through your pain and felt good 3/4 of the way through the workout and for an hour or two after. Again, those are endorphins. Curiously, or perhaps fortunately, laughter can also produce endorphins in the body. So it's time for a little break. Move on to the next section. We should clarify what we mean by acute pain and chronic pain. Acute pain is the pain a person has after an injury, such as a sprain or a fracture, and during the time it's healing. Chronic pain is pain that is present after that injury has healed or after an illness has been cured. You might have acute pain when you're experiencing influenza or COVID. Once the disease is under control, that pain usually gets better. Not for everybody, and that's when acute pain becomes chronic. So what causes acute pain to become chronic? On the right, you can see our pain and response loop with a person holding his or her upper abdomen, maybe their lower rib cage. But again, the red line is the signal indicating pain coming from an area, and the blue line the response to that pain. There's a saying, neurons that fire together wire together. The nervous system can literally memorize that pain pathway. If you think for a minute about muscle memory, things that you can do without giving it a thought, such as typing. If you're a good typist, maybe playing piano from memory, your fingers just fly and go where they have to go. It's a similar mechanism that hardwires the pain response. The hurt is re-experienced due to a re-injury, an aggravation, or ineffective treatment. The injury or infection may be healed, but the body and the nervous system remember. Things like depression, new injuries, and stress can make that hardwired loop fire again. And the pain is not imaginary. This is a look again at the level of the brain. The large red area in the center is the thalamus, where the pain signal first goes, and the smaller red area at the top of the gray matter is where a person consciously notes the pain. But you can see in the response loop, the blue line, there are inputs from other parts of the brain, both conscious and unconscious. Stress, fear, a new injury, anxiety, an illness such as the flu, they can all make that hardwired pain loop fire again. That helps people see how pain that starts as an injury or an illness can go on and become chronic pain and last long after the disease is cured or the injury is healed. Next, I'd like to talk about opioids, how they work, and why they can be dangerous. Let's talk about how opioids work. They work throughout the nervous system, mostly at the brain and the spinal cord. But first, we'll take a little detour and talk about cells and receptors. This is a diagram of a typical cell. You might wonder why I picked a diagram where the legend is in Dutch. Well, that's a fair question. The answer is because the details don't matter a whole lot for our discussion. What matters is what I've drawn in on the left. You'll see two channels, and this is where things like sodium, potassium, calcium, and magnesium go in and out. On the right, you'll see another channel that's labeled receptor. All cells have receptors. Some are for hormones, neurotransmitters, nutrients, or in this case, endorphins. The endorphin receptors in the body also respond to opioids, things like morphine and hydrocodone. A substance can have one of three actions on a receptor. It can be a full agonist, such as morphine is an mu receptor, and it produces the full effect that that substance creates. There are partial agonists, maybe you've heard of Suboxone. They produce a muted effect. It won't go overboard. The third type of action is called an antagonist. This is akin to Narcan, which you may have heard of. Narcan blocks the substance from bonding with the receptor and reverses the action. And that's why Narcan is given when a person overdoses. Remember, we said that we'd come back and talk more about synapses. These are the connections between the nerves that transmit a pain signal from the site of the injury or the illness to the brain. This is your average synapse. You can see that there are channels for sodium, potassium, magnesium, and calcium. The small lightning bolts in the bottom nerve are the pain signal coming from the injured area. The receptor nerve, or the other side of the synapse, the one that takes the signal to the brain, senses this based on what the first nerve releases into the gap. And the receptor nerve, that is the upper one, will release a substance called substance P and others that magnify that pain signal and send it on to the brain. And you can see there are mu receptors on the right-hand side that are empty. What happens when we add an opioid to the equation? The little green mushroom-shaped figures are an opioid, could be an endorphin. They bond with those mu receptors and they essentially turn down the volume on that pain signal by reducing the amount of substance P that the receptor nerve lets go of. Sounds pretty good, right? But there are problems with opioids because in addition to acting at nerve cells and the spinal cord, they act at cells in your respiratory system and the reward centers in your brain. They can cause a euphoria or an intoxication. This is what gets people hooked on opioids. They can suppress the drive to breathe. A person can literally stop breathing in their sleep from an overdose. Opioids can also cause nausea, constipation, poor balance, and they can slow your thinking. They can slow your reaction time. What happens if you take them for an extended period of time? You grow more receptors, and you'll need more of the drug to get the same effect. This diagram shows extra receptors that are there for the extra opioids. What happens if you stop taking the medicine all at once? Now you have a whole lot more receptors than you had before you started the medicine, and you go into withdrawal. Withdrawal means that you're going to experience the symptoms that are the exact opposite of what you experienced with the drug. The pain comes back, you might breathe rapidly, you might feel fear or paranoia, and if you had constipation, you'll probably get diarrhea, and the nausea likes to hang around either way. This is a picture of what happens, and you can see by the sad faces on the empty receptors that pain signal can actually get magnified. So hopefully that can help you see why, in spite of good intentions, taking opioids long term can perpetuate chronic pain. Morphine was great on the battlefield, and it's still very good for injuries when they're in the acute stage. But the medical thinking has progressed in the last 10 years such that we don't want people to take opioids any longer than they absolutely have to. Now, for some people, long-term treatment with opioids is appropriate. We're not saying that they're all bad, but judicious use is best. Coming back to our chronic pain loop, you may have heard of or known somebody with fibromyalgia or chronic regional pain syndrome. What is thought to be going on in these two conditions is that perpetual loop has an amplifier. The body is more sensitized to the pain input. It's like the microphone was up to a 9 or a 10, and the response, the speaker, if you will, is also turned up to a 9 or a 10. Now, maybe that perpetual loop can't be broken entirely, but it can be quieted down. In order to turn down the volume on that chronic pain, we have to look at the person as a whole person, body, mind, and spirit. What can we do to turn the volume down on that pain loop? There are a lot of things that can help in addition to pain medicine. There's therapy with a therapist, yoga, physical and occupational therapy, just to name a few. Art and music are also huge. You may have heard the term neuroplasticity. What it refers to is the brain is not fixed. You can grow new connections and you can tone down old harmful connections. This came into vogue in the early 2000s when a group of Tibetan monks wrote a book on the subject. There is a website sponsored by the Cleveland Clinic that gives a pretty good explanation of neuroplasticity. Now, it takes time and dedication, and I should state up front that people who have had a spinal cord injury are not candidates for training that will rebuild the spinal cord, but it can rewire your brain to help handle the pain and the stress that comes along with such an injury. When words fail, music speaks. So said the bard. Listening to music, whether it's your favorite type of music or anything that's soothing, can be very helpful. Performing goes a long way, especially if you perform with a group. Just singing along with the radio as you're driving down the road can also be very helpful. If you dance while you're singing, we'll give you bonus points. Next, I'd like to get to the part of the session that inspired me to put this class together. A few years ago, I was listening to public radio, and an author named David Hanscom came on. He's a neurosurgeon. He had back pain himself that was chronic. He didn't want to take a lot of medicines. He didn't want surgery. He developed a way of therapeutic writing, which was of great benefit to him. And I'd like to share some of that with you. Writing is very helpful. Therapeutic writing can take many forms. Some people write poetry. Some people write narrative stories. Some people keep a journal. The key thing to remember is that no one else has to read this in order for you to get the benefit. The most powerful words a person hears are the story he tells himself or she tells herself. Whatever stories we tell, putting it on paper, either explicitly or through an abstract idea, will be very powerful. Sometimes you just need to vent, and this is the first part of Dr. Hanscom's method. The idea is to take a piece of paper and a pen or a pencil and write for 3 to 5 minutes on what you don't like about your pain, about the medical system, about the meds you take, and how people relate to you. If you read the writing on the left, you'll see that this person is rather unhappy. Doing this can be really helpful if you discard the writing after it's done. You can read it over once or twice. You don't have to. This is like weeding the garden, clearing the junk out so you can move on to the next step. Later today, tonight, if you're experiencing chronic pain, I urge you to give this a try. In fact, if you want to pause the video right now, go ahead and do so. Write something, but remember, when you're done, run it through the shredder, wad it up and throw it in the trash, or burn it. Just discard it. Moving on to the second part of the method. Writing expressively helps in a lot of ways. It can help a person identify triggers, causes of their pain, and sources of relief. Journaling helps people in many situations. Professional problems personal problems, family situations, putting them down on paper helps you sort out what's important from what's trivial. Here's an example of what the journaling might look like. Met with Bob at Zoe's place today. The food was good. The noise was bad, though. Diane came by the table and asked about Jill's concert. I noticed that my neck got all tense. Getting ready with Jill was a big deal. I think that remembering how stressed I had been brought on neck pain, which brought on a headache. Later, I thought of what Jill played with Tom, Johnny, and Patricia. It was Mozart's Fourth String Quartet. I put a disc in and played the piece. It was soothing. Other ways of approaching this: if you're not comfortable writing about yourself, you can do a narrative about an imaginary person. You might put your poetry here. Remember, nobody else has to read this. Putting it down on paper is therapeutic in and of itself. As a side note, I would encourage people to use paper and pen or paper and pencil rather than a keyboard. There is something about coordinating your hand and eyes and body that integrates this better than doing it with a keyboard. Overview of Dr. Hanscom's method. There are two parts to it. There's the writing down your negative thoughts and throwing them away, and then journaling, where you try to identify triggers for your pain. If you can only do one of these, I suggest doing the negative thoughts and throw it away method. And like anything, this is not a one and done fix. It takes maintenance. You might not have to do it every day, but doing it a few times a week will be necessary for ongoing help. It's kind of like tending to a garden. You have to pull the weeds, but you also have to spread fertilizer, maybe plant food, trim the plants. Or if you prefer a different analogy, maintaining your car means changing the oil from time to time, keeping air in the tires, cleaning it. So let's go into a few other things that can help with chronic pain if you're not a writer or if you want additional help in handling it. Cognitive behavioral therapy is one of the forms of therapy that can help with chronic pain. You'll sit down with a therapist and go through the way your thoughts and actions interact with each other. Cognitive behavioral therapy, or CBT, targets the response to pain, social and environmental factors, and how they interact. It can teach a person how their thoughts, perceptions, stress, and emotions are related to the pain, and vice versa. It will provide a person with tools to handle the negative or maladaptive thoughts that come from having chronic pain. It works especially well in people with a problem-solver mindset. Movement is also very helpful with chronic pain. One of the things to be careful of is that you can work through the hurt without doing harm. That's where physical and occupational therapy come into the picture. A trained professional can guide you in the right movements so that you can regain the functions you've lost because of the chronic pain. They can also help rebuild muscle and other physical structures that have been damaged or have declined due to not having been used in a long time. Just moving can be real helpful. If you have been through physical therapy or you feel well enough that it's not necessary, finding a good yoga instructor or a Tai Chi instructor will help a great deal. Yoga helps with stability and balance. Tai Chi also helps with stability and balance. The difference is yoga can be a little bit more stressful on the muscles, and you want to have a qualified instructor. Tai Chi is more of a flowing movement that starts simple and becomes more complex. It's hard to overdo it with Tai Chi, but again, I would recommend finding an instructor who has been doing it with people who have had chronic pain. And finally, walking, perhaps the most underrated activity that there is. If you start with a short walk and gradually increase your distance and time, you may find that it is beneficial to the point where you don't need anything else. Mindfulness has been described as paying attention on purpose. Another way to phrase it is be here now. The idea is to separate from your thoughts and your story and somewhat from your pain. What this can do is it can help you recognize that you're more than your pain. You're a person experiencing pain, but you are not pain. Getting free of that mindset, even if it's just for a few minutes a day, can go a long way in turning that volume knob down on the perpetual loop we talked about earlier. Again, I recommend finding a teacher for mindfulness and meditation if this is something you're interested in. Maybe mindfulness and meditation don't appeal to you. It's not for everyone, but there are other ways to get out of that pain mindset. Creativity, any creative activity, is another great way to do it. You can think of it as a kind of play. Whether you like to draw, paint, sculpt, carve wood, or just fold paper airplanes, all of these are creative. All of them take you out of that frame of mind where you can become your pain. Drawing is not an expensive hobby. All you need is some paper and a couple pencils. Painting, you can get started for very little, and if it's something you really like, you can keep going. Sculpture, maybe a little more involved. Maybe you just like to carve wood. And folding paper, be your own boss. All of these activities can be very helpful in rewiring your brain. I've shown you that there are plenty of options beyond pills to help treat chronic pain. Some of them require professional assistance like physical therapy and occupational therapy. Most are best done with a qualified instructor. I'm thinking yoga, tai chi, and mindfulness meditation. Cognitive behavioral therapy does require a licensed therapist. There are a couple of things that you can do on your own, like the therapeutic writing and creativity, whether that's art, writing, or folding paper. Thank you for joining me. And in our second session, we're going to go into more detail on the therapeutic writing, and we'll talk a little more about music and art. In the third session, I hope to include the power of rituals and maybe some details on the mechanism of various pain medicines for people who are interested in going deeper. Thanks, and have a good day.